Most people have experienced a sunburn at some point in their lives. You spend a little too much time at the beach, at a sporting event, working in the yard, or even driving with the window open. At first, everything seems fine. Then several hours later, your skin becomes red, hot, tender, and painful. Many people think of a sunburn as a temporary inconvenience, a few uncomfortable days followed by peeling and recovery. But biologically speaking, a sunburn is much more significant than that. It is actually a form of radiation injury. The redness you see on their surface is evidence of cellular damage that has occurred deep within the skin. I'm Dr. Petrizzi, board-certified family medicine physician at PartnerMD Short Pump, with more than 20 years of practicing medicine. Today we'll explore what happens during a sunburn, how ultraviolet radiation damages skin cells, why your skin turns red and peels, and why the consequences of that damage can persist long after the burn itself has disappeared. Understanding ultraviolet radiation is the first thing we'll discuss. To understand sunburn, we first need to understand ultraviolet or UV radiation. Sunlight contains several different types of electromagnetic radiation. Some of it is visible light, which allows us to see. Some is infrared radiation, which we perceive as heat. Then there is ultraviolet radiation, which is invisible to the human eye. The two major forms of UV radiation that reach the Earth's surface are UVA and UVB. UVB rays have shorter wavelengths and higher energy. They primarily affect the outer layers of the skin and are the main cause of sunburn. UVA rays penetrate more deeply into the skin. They contribute less to the immediate redness of the sunburn, but play a major role in the skin aging and long-term skin damage. Both forms of UV radiation can damage DNA and contribute to skin cancer. Think of UV radiation as a system of tiny packets of energy striking your skin. Every moment you are exposed to sunlight, billions of photons are interacting with your skin cells. Most of the time, your body can handle the damage. When exposure exceeds your skin's ability to protect and repair itself, sunburn develops. The most important damage caused by UVA radiation occurs inside the nucleus of the skin cells, where DNA is stored. DNA contains the genetic instructions that tell cells how to function, repair themselves, and reproduce. UV radiation can directly alter the chemical structure of a DNA molecule. One of the most common forms of damage involves neighboring DNA bases becoming abnormally linked together. These lesions distort the DNA structure and interfere with normal cellular processes. Fortunately, bodies have developed sophisticated DNA repair systems. Specialized enzymes scan DNA for damage and attempt to remove and replace injured sections. Most of the time, these repair systems work remarkably well. However, when exposure is intense, damage can accumulate faster than it can be repaired. At that point, the body begins activating emergency responses. When a skin cell detects extensive DNA damage, it faces a critical decision. The damage can be repaired, the cell pauses its normal activities, while repairs are made. If the damage is too extensive, the cell may trigger a process called apoptosis, often referred to as programmed cell death. Apoptosis is essentially cellular self-destruction. Rather than risk becoming a malfunctioning or cancerous cell, the damaged cell dismantles itself in an orderly fashion and is eventually removed by the immune cell system. Under the microscope, these dying cells are often called sunburn cells. This may sound alarming, but it is actually a protective mechanism. Your body would rather sacrifice damaged cells than allow potentially dangerous mutations to persist. The peeling that often occurs several days after a sunburn is partly the visible result of this process. Large numbers of damaged skin cells are being shed and replaced by new ones. One interesting feature of sunburn is that it doesn't occur right away. You can spend several hours in the sun and your skin may look normal, but when you come inside, the redness often develops gradually over the next 6 to 24 hours. Why the delay? The redness is not the direct effect of UV radiation itself. Instead, it reflects the inflammatory responses triggered by the damage. When skin cells are injured, they release chemical messages that alert the immune system. These signals trigger blood vessel dilation and increase blood flow to the affected area. The increased blood flow is what gives the sunburned skin its characteristic red appearance. This process takes time, which is why the burn continues to worsen after you've already left the sun. What you're seeing is your body's response to the injury rather than the injury itself. Pain is another consequence of inflammation. The chemicals released by the injured cells sensitize nerve endings in the skin. Normally, harmless stimuli such as touching your shoulder or wearing a shirt suddenly become uncomfortable. The skin may feel hot because of the increased blood flow and ongoing inflammatory activity. In severe burns, swelling may develop as fluid leaks from the blood vessels into the surrounding tissues. This combination of redness, warmth, swelling, and pain represents the classic signs of inflammation that occur throughout the body whenever tissue is injured. Several days after sunburn, many people notice that skin begins to peel. Some assume that peeling is simply dry skin. In reality, peeling is evidence that damaged cells are being removed. The outermost layer of skin, called the epidermis, contains cells that were injured by UV exposure. Many of these cells have either died or are no longer functioning properly. As new cells develop underneath, the damaged layers separate and slough away. Peeling is therefore part of the healing process. The body is literally replacing injured tissue with newly generated skin. While sunburn is often thought of as superficial injury, important changes occur deeper within the skin. The skin contains structural proteins called collagen and elastin. Collagen provides strength and support. Elastin allows the skin to stretch and return to its original shape. Repeated UV exposure damages both of these proteins. Over time, the collagen fibers become fragmented and disorganized. The skin gradually loses elasticity, becomes thinner, and develops wrinkles. The process is known as photoaging. In fact, many of the visible signs commonly attributed to normal aging are actually the cumulative effects of decades of sun exposure. Researchers estimate that a substantial portion of facial aging is related to UV exposure rather than chronological age alone. Many people view a tan as a sign of health or vitality. Biologically, a tan is actually evidence that the skin has detected injury. When DNA damage occurs, specialized skin cells called melanocytes increase production of melanin. Melanin absorbs some UV radiation and helps protect deeper tissues. The resulting darkening of the skin is an adaptive response designed to reduce future damage. In other words, a tan represents your body's attempt to defend itself against additional UV injury. It is not evidence that damage has not occurred. The tan develops because damage has already occurred. Perhaps the most important long-term consequence of sunburn involves cancer risk. Every episode of significant UV exposure creates DNA damage. Although most damaged DNA is repaired successfully, some mutations escape detection. When mutations occur in genes that regulate cell growth, cells may begin behaving abnormally. Over many years, these mutations can accumulate. Eventually, enough genetic changes may occur to transform a normal skin cell into a cancer cell. The process contributes to common skin cancers such as basal cell carcinoma and squamous cell carcinoma. Research has shown that severe sunburns, especially those occurring during childhood and adolescence, are associated with an increased lifetime risk of melanoma also. The effects of a single day in the sun can therefore extend decades into the future. Does the skin ever fully forget a sunburn? An important concept in modern dermatology is that the skin has a kind of biological memory. Although the visible burns may disappear within days or weeks, some DNA mutations can remain permanently within the surviving skin cells. These altered cells may persist for years. Most never cause problems. However, each episode of UV exposure adds to the cumulative burden of cellular damage. This is why dermatologists emphasize lifetime sun protection rather than focusing solely on preventing immediate burns. The skin may look healed, but some of the molecular consequences can remain. The good news is that much of the damage is preventable. Protective clothing, wide-brim hats, seeking shade during peak sunlight hours, and regular use of broad-spectrum sunscreens can significantly reduce UV exposure. Broad-spectrum sunscreens protect against both UVA and UVB radiation. No sunscreen blocks all UVA radiation, but proper use substantially lowers the amount that reaches the skin. Sun protection is not simply about protecting discomfort tomorrow, it is about reducing cumulative DNA damage over the course of a lifetime. A sunburn is far more than a temporary cosmetic problem. It is a radiation-induced injury that begins at the level of the DNA. UV rays damage the genetic material inside the skin cells, trigger inflammation, activate cellular suicide programs, and can leave behind permanent mutations. The redness, pain, and peeling are only the visible signs of a much deeper biological process. Even after the burn fades, the skin continues dealing with the consequences of that injury through repair, regeneration, and sometimes the persistence of genetic damage that may influence health years later. Understanding what a sunburn actually is changes the way we think about sun exposure. It is not simply a matter of getting a little too much sun. It is a reminder that our skin is constantly balancing injury and repair, that every effort we make to protect it today can have benefits that last for decades. If you found this helpful, give this video a like and subscribe. For more breakdowns like this one, we'll covering more of the science behind everyday health questions. Thanks for watching, and I'll see you in the next one.